This is Jefferson Close-Up, and I'm Carol Celine. My guest is Dr. David Kastenberg. I can say it's nice to see you again because you went to high school in Cherry Hill with my daughter. But you had a bit of an unusual upbringing. Your father went back to medical school, or started medical school, when you were in 4th grade. So you had the experience of going to medical school with him, in essence. How did that impact your life?
Well, we moved to Cherry Hill because my dad changed careers, went from being a pharmacist to entering medical school. So, it was really neat to be with him during those 4 years. I mean, he would always eat dinner with us in the evening, but every night went upstairs to study, and, in his study were all his medical books, and, I got to meet all his friends who were going through it, and we sometimes would go away with him to various electives. So, it was really a part of my life from early on, and I think it definitely influenced me.
So you knew in high school that you were going to go to medical school?
When I was applying to college, I knew I was going to medical school.
So what about your work do you like best?
I like coming to work every day. I mean, I really enjoy the variety. It's cognitive. You have to think and solve problems, and you do things too. It's very hands-on. So I feel like I'm constantly using different parts of my brain, and every day is different, and I really like that.
So you're constantly challenged. Now you have 2 areas of specialty. One of them is celiac disease. Could you define that and tell us what you do?
Sure. Celiac disease is, you could think of it as an immune reaction to gluten, which is in wheat, rye, and barley. And patients who have celiac disease have a variety. Classically, they have GI symptoms like weight loss and abdominal discomfort. But it turns out that currently many patients with celiac present with what are considered atypical symptoms. So joint aches, neurologic symptoms, anemia. It's a very common disorder. It's one of the major issues with celiac is that the vast majority of people who have it don't realize that they do. So just a really small percentage of patients who have celiac are diagnosed.
Which surprised me because everywhere you go today you see all these gluten-free products. So there's obviously a large enough population to make it worthwhile.
Absolutely.
Right?
I mean, it's totally changed. I mean, there's really a really tremendously heightened recognition now of the disease, and there's a growing awareness.
I understand that Jefferson has a center specially to treat celiac disease.
Yes, we have the Jefferson Celiac Center, which Dr. DiMarino and I are the co-directors of, and we're really quite proud of it. It's a very integrated center that has physicians who are interested, pathologists, dietitians, and also specialists from the other areas that oftentimes affect celiac, like rheumatology and endocrine. So it's a very integrated approach to patients with celiac disease.
Now, colonoscopy is extremely important. There are about 15 million of them done in this country, you told me, and there should be twice as many because it's the first diagnosis for colon cancer. At what age should people start to have a colonoscopy, and how often should it be repeated?
Colonoscopy right now is considered the best test in terms of colon cancer screening. Most people would start at age 50, unless you have a family history. And that is sometimes confusing to people. What is a family history? So a family history is a first-degree relative with colon cancer. Or there are some unusual syndromes where people have a lot of cancers in their family. Those patients should start when they're 40. The average person starts at 50, and then the next colonoscopy is based on what you find at the first one. So if you have a normal colonoscopy in an average risk person at the age of 50, it's something you want to do every 10 years. So it's really important to do it well.
And that's some great advice you gave us. I hope everybody listens. Thanks for joining us.
Thanks for having me.